Hi, my name is Katherine Shelton. I am a student at Indiana State University, enrolled in the LPN to RN bachelor's program, and this is my sixth health education project for Nursing 444, Community Health Nursing. And our topic for today is to discuss pregnancy prevention among adolescents. So the learning objectives for today are to discuss trends in teen pregnancy, discuss different forms of birth control available, discuss consequences of teen pregnancy, and be able to list ways to access forms of birth control, condoms, and other resources available. So I do have a pre-test that we will take first, just to evaluate your knowledge before going into the rest of the presentation. So for this community health project, I wanted to discuss the importance of sex education. Pregnancy prevention begins with teaching adolescents about their bodies, sexual maturity and consent, and responsibility. Sex education also draws attention to the risks associated with becoming sexually active, including the risk of sexually transmitted infections and unwanted pregnancy. I hope this presentation will draw attention to the local support available to teens and young adults as they navigate through sexual maturity. Physicians, parents, schools, and local resources within the community play an important role in decreasing incidence of adolescent pregnancy. So, trends in teen pregnancy. The pregnancy rate in the United States has been declining since 1991, but still the U.S. teen pregnancy rate is the highest out of all other Western industrialized nations. In 2016, it was calculated that 1 out of 4 girls in the U.S. will become pregnant before the age of 20. U.S. teen pregnancy rates do differ between states and ethnic groups. According to the CDC, in 2016, 1 in 3 Hispanic females will become pregnant by 20, whereas 2 out of 5 African American females will become pregnant by the age of 20. The United States, again, still does have the highest teen birth rate out of all other industrialized nations. So this is just a graph that shows birth rates in teens from 2018 to 2019. You can see there continues to be a decline in birth rates, but the reason is not entirely clear. It is thought more teens are abstaining from sex and using birth control. This chart shows that there is a slight decrease in birth rates, but it is still rather small. This shows that there is still a need for increased sex education among teens and access to resources to prevent teen pregnancy. So preventing teen pregnancy, the only real way to 100% prevent pregnancy is through abstinence, and that is defined as not engaging in penis and vaginal intercourse or avoiding sperm from encountering the vagina or vulva. Studies have shown that teens are more likely to use unreliable forms of birth control and less consistently. The most common forms of contraception used by teens are condoms and birth control pills. However, these are the least effective at preventing pregnancy when they're not used properly or consistently. Sexually active adolescents should understand the importance of consistency in using condoms and birth control to prevent pregnancy. So, forms of contraception. There's something called the barrier method. These will include male and female condoms, a diaphragm, spermicide, and withdrawal. These methods are the least effective at protecting against pregnancy, especially the withdrawal method. It is important to mention that these methods must be used consistently, like we said earlier, and teenagers tend to be less consistent with using these forms of birth control. However, male and female condoms can reduce the risk of some sexually transmitted infections, unlike other forms of contraception that are available. Then there are the hormonal methods. These include oral birth control pills, implants, vaginal rings, and injections like the Depo-Provera shot, oral birth control must be taken daily to be effective. The benefit of the other hormonal methods, such as the implant, vaginal rings, and injections, is that one does not have to remember to take these daily. The implant is effective for 3 years, and Depo-Provera shot is effective for 3 months. These methods have been found to be 95% effective at preventing pregnancy. And then we have the intrauterine method. These are also called IUDs. The hormonal method of IUD are effective for 3 to 6 years, depending on the specific product, whereas non-hormonal, called Paragard, are effective for up to 10 years. These ones have found to be 99% effective at preventing pregnancy. And then there is emergency contraception. The Paragard, like we mentioned in the just a moment ago, the non-hormonal IUD can be inserted 5 days after unprotected sex to prevent pregnancy. Plan B, or sometimes called the morning after pill, can be taken up to 72 hours after unprotected sex to prevent pregnancy. And that can be purchased at pharmacies without a prescription. Teenagers who are sexually active may want to consider a long-acting form of contraception, such as oral forms of birth control, as oral forms of birth control must be taken daily to prevent pregnancy, and teenagers tend to be less likely to use condoms consistently. So there are consequences of teen pregnancy for both parent and child. Teenage mothers have a lower probability of receiving their high school diploma or GED. It is estimated that only 50% of teenage mothers will have their high school diploma or a GED by the age of 22. It has been estimated that only 10% of teenage mothers will complete a 2-year or 4-year degree. And then the economic and financial impact. Teenage mothers are more likely to live in poverty and may not have the financial support from the father. They have a lower probability of completing high school or higher education, which can also impact the mother's financial status. Impact on the child. Children of teenage mothers are more likely to experience a wide range of issues. These can include a lower birth weight, cognitive and behavioral issues, less cognitive stimulation during development, less emotional support, higher rates of foster care placement. They tend to be more likely to give birth as a teenager as well, and tend to have a higher rate of incarceration. So resources available. Many teens may be fearful or feel uncomfortable seeking out medical advice or help from their parental figures when it comes to contraception. Many states do allow for teens to have access to contraception services without their parents' permission through clinical sites such as Planned Parenthood. And the below sites included on this slide provide programs available to youth across the United States. These are my references, and this does include some of the resources as well. And now we can take that post test, and I hope you gain some new knowledge from this presentation. Thank you very much.